Okay, so I'm gonna start. Yeah, that's fine.
There you go. You're live.
All right, thank you. Hello, everyone. As this meeting was advertised widely, I will introduce myself. I'm Hendrina Quinnen, the Councillor for Handsworth Ward and Chair of this forum. Welcome all to our first virtual meeting in Handsworth Ward. As you may know, the Council is trialling holding Ward Forum meetings online so that residents and stakeholders could get the opportunity to receive ward-related updates and ask questions. Could I advise that this meeting is being held in public and a recording will be available for public future record. I'm pleased to inform that we have officers lined up to give us their reports. I will invite them to first introduce themselves before speaking to us and also respond to questions asked. So should you wish to ask a question, please type it in the chat box on the right side of the screen. Could I now welcome Dr. Justine Varney, the Director of Public Health, and ask if you could give us an update on coronavirus. Dr. Varney, over to you.
Thank you, Councillor, and glad to be with you this evening. So what I thought I would do is just give a bit of an overview about where we are in terms of the coronavirus outbreak. I'll talk a little bit about the different types of testing and then the test and trace service, and then answer any questions that colleagues have. So as you'll be aware, COVID-19 appeared in the world in China in December. We saw the first cases come to the UK in early February, and we had our first case in Birmingham at the beginning of March. And we saw a very rapid increase in the number of cases over March, April, and then from May there's been a gradual decline in the number of new cases. And what we've seen over the last couple of weeks in Birmingham is a lower number of new cases every day. But what we have seen is a change in the pattern. So in May, the majority of new cases were in the elderly, in people particularly in care homes, and it was in people coming into hospital. Now most of the cases we see are in people who are in the community, and increasingly the largest proportion of people who are testing positive are of working age, so people aged between 19 and 64. And that's been quite a marked change particularly over June, as we're seeing many more people of working age testing positive than we did before. What I expect is we will continue to see a relatively stable rate of new infections. The national surveillance has shown that only 20% of people in the country have had COVID-19 so far. So there's still, for a lot of us, that haven't caught it yet. And that's why it's so important that we keep aware, we stay alert, we keep washing our hands, keeping that distance. And I'm sure the government will be updating its advice on masks to encourage more of us to wear those when we go into shops or into other enclosed spaces. It is unlikely that we will see a vaccine within the next 6 to 12 months rolled out for mass vaccination, and that's because to develop a vaccine takes time. There's been a huge global effort to develop a vaccine, but once we have found one that works, it then takes about 6 months to manufacture enough vaccine and get the system ready, and then it needs to be rolled out, and then we all need to choose and book appointments and go and get our jabs. So I think we will be in this strange COVID world for at least another year. Is likely. So, you know, that's the kind of world we're in. Whether we get a second wave, I think is probably when rather than if. If 4/5 of us, 80% still haven't had it yet, there's still quite a strong likelihood that as we come out and become more social and spend more time visiting people, and it's particularly that indoor exposure that's a risk, that we will see case numbers increase and we will see a second wave. And the question is, how flat is that second wave, and can the NHS cope, or do we see a rapid increase as we did in March, and then we'd be looking about going back into a kind of lockdown type scenario? So just moving on, in terms of what's really helping us through this is the National Test and Trace programme. And that's, I suppose, my ask of everyone. If you develop symptoms, then please ring 119 or go onto the NHS website and book a test. You can either get a test sent to your house through the post, or you'll be offered an appointment at one of the drive-through sites, which in Birmingham, the closest one is in the Edgbaston Cricket Ground car park. Or if you live within walking distance of Newtown, we have a walk-through site on Villa Street, but you have to book an appointment for it. So it's not something you queue up for. You have to ring and book like everything else. And we are looking at how we can develop more sites like that across the city to increase access for people that don't have cars, because both the walk-through site and the drive-through site, you get your result usually within 24 hours, where the postal kit just takes a bit longer. So it's all helpful. If you do have symptoms, you need to stay at home for 7 days, and anyone you live with stays at home for 14 days. And if you test positive, then they definitely have to do the 14 days. If you test negative, then you continue until you've done 7 days, but everyone else can go out again. And that's why the testing is so important. It's really important, if you test positive, that if you are contacted then by the National Testing Service, you're honest about where you've been. This isn't a punishment thing. If you've done something you shouldn't have done, please confess it, tell us, because otherwise we don't know. And the real risk is that people aren't honest about where they've been and who they've been to visit. And ultimately, the risk is they've been somewhere and that those people that they've been in contact with are exposed and they just don't know. And if we can contact them and let them know, then they can be aware and look out for the signs and the symptoms. So it is really, really important that people engage with that. One of the things I will touch on is a bit about the outbreak. So there's been a lot in the media in the last day or so about a farm in Herefordshire. Before that, there was a meat packing factory in Sandwell. In Birmingham, we haven't had so far, touch wood, anything that comes near to the scale of those situations. We get about 10 to 15 new situations a week. And when I say a situation, that's a setting like a school or a care home or a workplace where we've been contacted by Public Health England because there's a suspected case. So if you think in the size of Birmingham, having 13 to 15 a week is tiny. So I'm reasonably comfortable at the moment, and we've done a huge amount of work with businesses and schools and faith settings to help them prepare to make sure they're COVID safe as they open up, and also making sure they're keeping vigilant and trying to keep an eye out for people and for cases. The final thing I'll share is some of our thinking about how can we help you prepare for wave 2. So you'll be aware that there are various risk factors that are associated with an increased chance of death if you catch COVID. The most important one is age, and you can't do anything about your age. Don't believe what all the makeup tells you in terms of the creams and stuff. You can't turn back the clock, I'm afraid, in that sense. So, but it is particularly for people over the age of 70 are more vulnerable to dying. Men are more vulnerable than women. People who are very overweight and obese, so have a body mass index of over 40. People who have long-term conditions like diabetes, high blood pressure, kidney disease and chronic airways disease are all at higher risk. And the more poorly controlled your condition is, the higher your risk. So if you're a diabetic and you can't get on top of your sugars, then you are a much higher risk than someone who's very, very in control of their diabetes. And then finally, ethnicity is also associated with an increased risk. And for all non-white British ethnic groups, there is an increased risk, but it is most significant in Bangladeshi and Black African and Caribbean communities. And what we think is the majority of that is because those communities have higher rates of conditions like diabetes, but not just that they have more diabetes, but also that diabetes has not been looked after as well by the NHS as people who are white British. And there's research from before COVID that clearly showed that inequality existed. So it is a kind of combination of various factors. We also know that obesity is more common, particularly in our Afro-Caribbean community. Men are also more likely than women to be obese and overweight. So it's how all of these things interplay. But the key message I want to get across, though, is that you can't do anything about your age, you can't do anything about your gender or your ethnicity in terms of your risk. What you can do is get on top of your health if you've got a long-term condition. And we've been working with GPs across the city to help them recognise that, to make sure that they are engaging with patients. And there's a thing called a long-term disease check. So if you're someone who has diabetes, you should be having an annual conversation with the practice nurse or one of the GPs where they go through with you, how are you looking after your diabetes? And we know not everyone's great at going to those, because when you're well, you don't really worry about it. So now's the time to get on top of your health. Things like giving up smoking make a difference. And we just launched a new app called Bella to help you. There is a lot of support out there, and ultimately the challenge for us in the council and with the NHS is we can tell you how to change, but it is up to all of us as an individual to make the change ourselves. And what you'll see increasingly over the next couple of weeks and months is more tools and resources to help support people around changing their diet, making it healthier, becoming more physically active, giving up smoking, managing your diabetes, your high blood pressure, all of those things. But it is ultimately only you that can make the choice to take the action. So I'll finish there, Councillor. Should I pick up some of the questions that are in the chat?
Yes, please, Jasmine.
So there was a question from Rahib about the reason why we're seeing increased working age people. So what we're looking at the moment is, I think the reason we're seeing more working age adults testing positive is people are starting to go back into work, they're socializing more, and that we would naturally start to see that shift. I also think that in Birmingham, we haven't had it hasn't been as bad as it might have been in our care homes, and I think that's a testament to all our care workers and the care home managers across the city who've worked incredibly hard to try and protect care home patients and residents. The other thing to keep in mind, of course, is that in May, the majority of people who had symptoms couldn't get a test. So we may well have had more working age adults then, it's just they weren't testing, whereas now anyone who's got symptoms can get a test. But it is well over 70% of the new cases in the last week were in working age adults, and I think it probably is because people are out socializing more as well as working. What we are also doing is keeping an eye on the numbers across the city, so particularly looking at small geographies, so what's called medium super output areas and lower super output areas, and these are geographies that are smaller than the wards. And in general, what we're seeing is that there isn't a huge amount of variation. So I'll just pause for a second. I think someone's not got their mic on mute. There we go. Thank you.
I know what you mean. I know what you mean. I feel that way when I say I'll do something and then can't.
Hi, whoever's talking on the phone, would you mind popping yourself on mute, please?
Councillor, oh, that's it.
There we go, lovely. That's all right, thank you.
I apologize.
No problem, Councillor, sorry. It's the nature of us home working, isn't it, that the families keep working around us.
Yeah.
The point about the geography at the moment, what we're not seeing is significant variation across the city. And on Friday, government published down to medium super output area the variation in terms of the number of cases, both across a week and the total across since we've had data. And what that's shown us is that there is some variation, but most of this can be explained by care homes. So one of the areas, for example, is the patch around Chester Road, and that has one of the higher levels of number of cases so far through the outbreak. Now we know in that particular geography there are about 7 care homes and they've all been affected by COVID. So that's really changed the picture, and if you took those care home numbers out, then they would drop back down and they'd be much more like the rest of the city. So we are starting to just do some more digging in that to really understand, is there anything else we haven't recognised? But the majority of the city at the moment, most wards are seeing between 3 and 5 new cases a week, relatively spread out. And we're not seeing particular hotspots at the moment. So, but as I say, I'm looking at that very, very closely and keeping an eye on it. So I think that was the only question that came up so far.
Right. Can I thank you, Justine, for giving us this update? This period of coronavirus has been really very difficult to almost all of us. So thank you very much. And now I'm going to move on to the next. I'm going to move on to the next item, which is which I'll receive an update about our Health and Wellbeing Centre. I think that's right. So Anne, are you there? Anne, can you hear me?
Councillor Quinlan, we haven't managed to get Anne on yet. Could you move on to the next item?
Okay. So we will come back to that one. I understand we've got Robert Chon, who is going to tell us about Section 106 funding and the possible project. And hopefully, Rob, are you there? Can you hear me?
Councillor Quinlan, we're having a few technical problems at the moment. Would you like to deal with the residents' questions? And we're trying to get Rob and Anne on.
Okay. Right, so we go to residents' questions. That's item 7. Yeah, item 7. Okay. Yeah. Right, I'm gonna take item 7 now. Any urgent business. Some residents had sent their questions in advance, and I contacted Janae Christie, who is the case officer dealing with the planning application for 36 Hinstock Road. So I will read the response that I have received. Thank you for your comments in relation to this planning application. The concerns identified had been taken on board, and I have provided responses to some of the queries raised. HMOs consisting of less than 6 people in Birmingham would not have required planning permission before 8th June 2020, and therefore a planning consultation would not have taken place for number 36 Hinstock Road if operating as this use as this use before that date. Number 64, Hinstock Road, has no historic record of any planning application, and there does not seem to be an HMO license. If an unlawful use as an HMO is suspected, it is advised to please contact our enforcement department, who will look into this further. So I will do that. As of 8th June 2020, an Article 4 direction was passed. This policy means that all new changes of use application from family homes to HMOs would require planning permission. In terms, the number of residential care homes registered within 1 mile radius of 36 Hinstock Road, the application is still under review, and the number of care homes in the area is still being assessed. During the COVID-19 pandemic, the scheme of delegation has changed. In the event where there is a substantial local public opposition to the officer's recommendation, substantial shall be considered as 20 or more representations against the recommendation, or where a valid petition of more than 20 signatories has been submitted in accordance with the council's rules. The below roads have area of restraint orders in Handsworth Wood Ward and Handsworth Ward, Handsworth Wood, Handsworth Wood Road and Selborne Road, Somerset Road in Handsworth, Heathfield Road, which is Heathfield Road, Wycliffe Road, that is now, according to new boundaries, it's in Birchfield Ward, and one side of Hampstead Road. And then in Handsworth Ward, we've got Lansdowne Road, Thornhill Road, Vicarage Road is not in Handsworth Ward, Park Avenue, Richmond Road, those are not in New Handsworth Ward. Relating to asylum seekers fall outside the planning remit. For enquiries, the asylum seeker point of contact within Birmingham City Council is natasha.bundle@birmingham.gov.uk, who should be able to assist for further information. Please note that all comments and objections received by members of the public will be considered before any decision is made, and the proposed development will be assessed against national and local planning policies. Should you have any further queries relating to this planning application, please do not hesitate to get in touch. So this is the response that I received from planning department so far. Right, so Leslie, could we go back and see? Right, let's see.
Councillor Quinnan, did you want to have a look in the Q&A? There's a couple of questions come in.
Yes.
While we're still trying to get the officers on board.
Yeah, I'll just have a look. Right, let's have a look. Right. No, I haven't got any questions on Q&A. Leslie, I haven't got any questions here. Are you there? Leslie,
Yes, Councillor, I'm here.
can you hear me? No, I haven't got any questions here.
Okay. We've had apologies from Bob and Anne. They were able to get on briefly, but they've had to send their apologies. We're having a few technical issues. So if anybody that's listening could email in their problems or queries with these two items, and we'll get them sent over to the officers and ask the officers to respond directly to the residents.
So that's Anne and Rob.
Anne and Rob, yes, they've both just sent their apologies to Neil. We're having a few technical issues tonight. I can only apologise for that.
Okay. And what about right? Okay, if there are any questions for item 4, which is Health and Wellbeing Centre, or section 106, could the residents just either email me directly, or you could post them here. So item 6, we were expecting the policing. Have we received anything from the police, Neil or Leslie?
I haven't received anything from the police, Councillor Quinnen. Neil, have you?
Hello, all. No, Councillor Quinnen, I haven't received anything from the police either. If you wanted me to, in regards to section 106, however, I can just give a bit of a summary on how much money has come into the ward under section 106, and then I can just talk a little bit about how it works in other wards and how it might work within Handsworth ward, if that would help, Councillor Quinnen.
Yes, Neil, and you can explain to us what section 106 is. Okay, Neil, over to you.
Thank you. I'm just expecting Leslie to just turn me live, hopefully. Yes, I'm live. Okay, so good evening, everybody. I didn't expect to present this evening, but in the absence of officers, what I'd like to do is to let you know how much money from a section 106 receipt has come into the ward, and also to give you a bit of an idea on what section 106 funding can be spent on. So in terms of Handsworth ward, there are two sums that have been received. One is for the sum of £39,234, and the other is for £50,187, and they're funds received from planning applications that are linked to developments. Now, in terms of the status of this funding, no projects have been identified to date, and in line with your ward plan, what you will need to do in conjunction with Councillor Quinnen is to gain details of the grant agreement and also the terms of the agreement, and then hopefully that will give you the opportunity to come up with specified projects which match with your ward plan, which Robert Churn's team, the landscape practice group, would then have to confirm and verify with yourselves. So it's good news in the sense that the ward does have a section 106 receipt, which could be put towards some of your priorities within your ward, which are linked again to the agreement and the terms of the agreement. And what we'll do outside of the meeting is provide you with more information on that. So hopefully that helps, Councillor Quinnen. And what I will remind everybody, and I can forward the link, or Leslie can forward the link following the meeting, is that you have produced a ward plan, and thank you for all those that have contributed to that plan. And that is now available via the BCC Birmingham City Council website. So what we'll do also, we'll forward the link to that ward plan as well, because you'll be aware that it's a working plan. So therefore it's still developing. So you have to work with Councillor Quinnen and also the other stakeholders, local stakeholders from within the ward, to actually help to come up with projects and also an approach to delivery on priorities within your ward. So hopefully that helps, Councillor Quinnan.
Yes.
Over
yes.
to
Thank
yourself.
you.
Thanks,
Yes.
Leslie.
Right. Thank you, Neil. That was helpful. I was looking to see if there are any questions. No, I can't see any questions. Leslie, are there any questions?
Yeah, I'm just having a check now.
If you look in the new box on the Q&A, there are a couple of questions that have come in.
Okay. All right. Okay.
I don't know whether you want to reply to those privately, because some of them will need private replies as opposed to public ones.
Okay, I can see Tim from Grove Residents Association there. Can you see the question from Tim, Leslie? Can you see the question from Tim?
With regard to access,
with regards to the Zoom presentation.
Yeah, no, I've responded to that one privately, Councillor.
Okay, that's fine. Thank you.
If you scroll down, there are a few more questions in the Q&A. It's whether you want to respond to them privately or publicly.
So, Councillor Quinnan, I've had a look through the questions, if you don't mind me interjecting, and I think quite a few of them are quite specific, so it might be a good idea to respond to them outside of the virtual meeting.
Right, there's one about 36 Hinstock Road, explanation around HMO status. Somebody is asking if that can be repeated. HMO change was made and no permission was required. It's anonymous. Could I ask the person to email me directly so that I can send the information? Neil, would that be okay?
Yeah, I think the person, you stated they did not need a license for a HMO. Why, when the proposal is for 9 residents? So yeah, I don't think that was picked up actually within the overview that you gave from the planning officer. So yes, I just think that in relation to some of the specific questions, it's best to go back to the residents directly. So it'd be really helpful if people could provide their contact details so we can get back to them.
Yeah, there is yeah. Can I ask the person who asked that question to email me directly, hendrina.quinnan@birmingham.gov.uk. I can see another question here. Is there any way in which the distinct nature of the park can be preserved by retaining the residential nature of Hinstock Road when planning for 36 is considered? Now, because we haven't got the planning officer, Neil, could you pick up on that one, please?
Again, it's not for myself to comment because I'm not a planning officer, but what we can do, we did have an officer that kindly responded very quickly to us. So what we'll do, we'll forward that query to them and get back to you with a response. And I've just noticed, I'm just looking at the Q&A now, so there are a couple of more questions that have come in. So there was a person that said there has already been a petition against the care home at 36 Hinstock Road with more than 20 signatures. Do you still want us all to object individually, since there are a vast number of us who are against the development of the care home? Also, since it is after HMO rules development date, an inspection should be carried out that it is being used as a HMO, or whether the application is incorrect. So I just think that it would be sensible and appropriate for you to object individually. And I believe Councillor Quinan, you're also going to respond as well on behalf of the residents that have already contacted yourself with your own personal view, and also with the stakeholders as well. That's the case, isn't it?
Yes.
So I think it would be best for, you know, both options to be pursued.
Yeah, so the residents can still submit as individuals.
Yeah, and also Naomi has been in touch. Good evening, Naomi. Can we get the planning department to come to the next ward meeting, as we really need to see how planning is responding in the area post June 2020. So that's a request from Naomi to ask for a planning officer to come along or be involved in the next virtual meeting.
Yeah. Yes, I can see another comment that says it's never been HMO. It's wrong to say so. It's wrong to say so is misleading. Why are you saying it cannot be with now? This is not a private matter. Right. I think what I will say, I'm pleased that the residents, you have got these concerns. Could I ask that you email me directly so that we can make sure that all your comments are provided before the planning. So I'm asking you to email directly to, I email directly to the planning officer, janae.christie@birmingham.gov.uk, or you can copy me into the correspondence. That would be fine. Right. Is there anything else? Can you pick up any other question, Neil or Leslie? Hello, Leslie, are you there?
Yes, Councillor Quinan.
Is there any?
Just a couple. So a member of the public has asked if you can tell the public whether you're going to object in your capacity as a councillor to the planning application. Let me have a look.
Yes, I can see that question, Neil. Yes, I in my letter I will object in my right as a councillor and to support the residents.
Okay, there is another comment. There's been a couple of comments actually, which have said that this format of the meeting hasn't allowed residents and stakeholders to interact. A few people questioning whether it's a valid meeting, but at the start of the meeting you did actually explain, Councillor Quinan, that this is a first virtual meeting, and the reason why the meeting has been set up this way is because of the lockdown restrictions, and also that you wanted to give members of the public an opportunity to interact and to ask questions, etc. So hopefully that covers the purpose of these virtual meetings. But as soon as lockdown restrictions allow, and also in terms of the guidelines that we're given, I'm sure we will return to an open meeting forum as we have in the past, but obviously we're awaiting guidance for that.
Yes, I can pick up another question could we ask for a meeting with you, Councillor, even if virtual, to ensure our concerns are listened to? I'm not sure if the meeting with me, because the decisions have to be made by the planning. I think it is helpful if you send all your concerns or call me. You can call me or email me, and I can call you back to hear your views on this. I don't know if you want to add something to that, Neil.
No, the only thing that I would say is, you know, in terms of this format, this is a format that's happening in other wards as well. I explained before that the reason for this type of format is just to enable you as a ward councillor in your local leadership role to have that interaction, to get residents, you know, kind of concerns or questions, etc., etc. What we will be seeking to do, obviously, is to revert to the normal format as soon as we can. There is somebody that has asked if it would be possible to have a meeting with yourself, Councillor Quinnen, or even a virtual meeting to ensure that you know, their concerns are listened to. I'm sure that if you were open to that, you could look to organise a virtual meeting, maybe with a representative from the planning department and yourself outside of this forum.
Okay.
But again, that will be a specific meeting and you would need to make that decision. But I'm sure you could look into that.
Yeah, okay. Right, are there any, can you pick up any other questions? Right. I could see. Neil, did you say yes? We are going to have this record, so we can go back and make sure that we can have access to the issues that people are raising here.
Yeah. So in terms of this evening's meeting, what happens is there is an automatic live recording that is available to residents and stakeholders, so they wish to access it, and we can provide details outside of the meeting.
Right. Okay. Right, here's another question. Will we be told in advance of the planning meeting to consider the planning application? Would you know whether the planning will inform the residents who had inquired when they are going to make those decisions? Do you know, Neil? That's another question there.
Okay, so I won't be able to feedback on that, Councillor Quinnen, and obviously residents are really concerned in regards to this issue, and they you know, would like to kind of meet and to have more of a detailed response from the planning department. So again, I think it's best to collect all of the comments and the questions that have been raised for us to forward them on to the relevant planning officer, and then you could make a decision, and it will be your decision as to whether you want to have a specific virtual meeting in regards to residents' concerns about it. So you can organise that outside of this meeting, but I just think that so many questions are coming in, and thank you to people for sending your questions in. I think that you should make sure that you make a record of them, and what you should do is just to seek to set up a separate meeting, I think, with planners with regards to this issue. And I think people would like the opportunity to be able to interact. You know, so it would be Microsoft Teams, I suggest, that would be used as opposed to this question and answer format, which I think is proving a bit difficult for some of the participants.
Yeah, okay, so I will, as I could see that the questions that are coming up regarding this planning application, I think it would be helpful if we could have, if it is, it would be allowed to have the planning officer in a private meeting with, virtually, to look into the issues that are raised here. So yes, I will explore this option of having a virtual meeting with the residents and the planning department. Yeah, thank you. Is there any other question here? Is there any other question you can see, Leslie or Neil, that we haven't covered?
There's just the planning questions that I can see, which I think majority will need private replies, and there are some comments.
Right. I can see there, Naomi. You are saying people need to keep copies of everything, and they can ask to speak at the planning committee if it gets to that stage. Yeah. Okay. You have had. Right. Okay. Right. I think there aren't any other questions now. Are there? Have we missed out any other question, Neil?
No, as Leslie said, no. I think that they all relate to planning issues, which should be dealt with, I think, outside of this meeting. If the police haven't sent an update, which I don't think they have because I haven't seen one, I think we're on any other business and the close of the meeting, Councillor Quinnan.
Yeah. Shall we look at item 8, the future meetings? Leslie, I was thinking if we could meet again on the 20th of October. I've got that provisional date. Would you like to check your diary, Neil and Leslie, and confirm if that date is okay?
That date's fine with me, Councillor. I don't have anything booked for October yet. So
the 20th.
What time?
I think 5 o'clock is it all right?
That's fine.
Yeah, same time.
That's fine with me. Yeah.
Neil will.
That's fine for me as well, Councillor Quinnan.
Yeah.
That's fine.
So the next virtual meeting will be on the 20th of October. So on that note, could I again thank everyone who has joined into this meeting. As we said, it's a learning curve. We will be getting better as we do it. Until that time, if we can meet face to face as previously. So thank you and bye-bye.